Okay, today is Saturday the 7th of December 2013, and I have two guests here that are going to take a minute or two to talk with me. Could you please introduce yourselves?
I'm Roger Stakely.
Okay.
And I'm Dominica Stakely.
It's nice to meet you both. First of all, explain to us, if you would, why you're here and consulting with Dr. Brown.
We have a son that just turned 3 in August, and about a year and a half ago we noticed that he wasn't doing any kind of verbal communication. Everything else seemed great, but it did start to concern us, so we sought some help through speech therapy, and through that avenue it turned out that the problem was a little more severe than we realized. Had several specialists look over him. The developmental apraxia came up, and we started seeking outside sources to try and help our son. And he was making a very slow progress. Was making progress, but it was slow. And I work at a veterinary clinic, and one of my clients had a little boy that had some trouble with his own speech and recommended to see a functional neurologist, Dr. Brown. And about 6 weeks ago was our first time to meet Dr. Brown. And he told us so much more than anybody else told us. He explained to us exactly what was happening to our son, how we could help at home, taught us how to do exercises ourselves instead of depending on other people that didn't have the experience that was required to help him. And in the 6 weeks that Alexander has been doing these exercises with his therapist, with Dr. Brown, and with us as parents, his speech has improved in the last 6 weeks the same amount that it did over a year and a half span. It has incredibly boosted. He can say sentences now. He can verbalize what he wants. It has made a huge difference in him. He wasn't able to interact with other kids, which was probably the hardest on him and the hardest for us to watch. He actually has a best friend now. He didn't have that 6 weeks ago.
Excellent. Very good. So how often do you see Dr. Brown?
We've been seeing him every 2 weeks.
Okay, and then with what he's taught you, does that mean you're able to continue those programs between your visits?
Exactly. He's the first doctor that sat down with us, told us what to do with Alexander and how to react to him when he's having a hard time verbalizing and communicating, and how we should deal with that situation, which was a very important part of his therapy that nobody else had ever addressed. But we do it all at home.
Excellent, very good. So he, from his session today, obviously we observed that he used various appliances and props to help in that. Are you able to pursue that at home? I mean, what he's taught you, is it a very extensive and burden, perhaps we might say, on you, or has he made it available to you at a very reasonable personal cost, shall we say, whether it be time or money?
No, the things that he has had us do require very little props. And the props that we have, yes, they help, but they are things that we went out and got ourselves, that we figured out would help him in this journey to articulate his words, but they were not required. These were balancing techniques.
Things that anybody could do.
Anybody could do anywhere. His teacher has him do it at school. She has all the students do it so he doesn't feel left out. So it's easy for anybody to do in any environment.
That sounds excellent. So in actual fact, what Dr. Brown's provided to you is actually something that is being incorporated in the school to an extent and is benefiting other children as a byproduct then.
Yes,
it's really beneficial to it.
His teacher personally told me that there was another child in his class that also was not communicating very well and probably didn't have quite as an aggressive approach, the parents, and she has seen improvement in that child starting the exercises that Dr. Brown told her about.
One, to me, significant event that occurred is that we've had him for a few months seeing a private speech therapist. She's highly recommended. She's taught it at universities and is well known in the community. And when we told her about the experience with Dr. Brown, she sought permission to come down here to view it. She got so excited she was out on the floor. Grown woman's been doing this for 30 some odd 40 years. Was out on the floor, and literally the lady who was working with Alexander doing the exercises that Dr. Brown had instructed her to do, literally had to say, well, you know, there might be a few more hands involved than necessary, but it was all very exciting to see. And she got so excited about it that she came back later and said that she's incorporating many of those techniques with her own children at school. She also teaches at a public school in Birmingham, in addition to doing the private work. So I was pretty excited about that. That's what I like about him, Dr. Brown. He has the ability to articulate what he's thinking in such a way that you can understand him. I'm not saying he dumbs it down, because he doesn't. He uses a scientific terminology. I'm married to a doctor, so I'm used to that. But then he breaks it down in such a way that you can absolutely understand. More importantly, I myself have seen many neurologists and neurosurgeons over the years. I had a stroke 13 years ago. I was in excellent health, quite out of the blue. It could happen to anyone. And since that time, up until this day, I've seen obviously a number of doctors been put on various medications, taken off medications, put on other medications. And generally, the nature of the visit will be you go in, tell the history, write the prescription, and you leave. I have this fellow in one visit, explaining to me stuff that I've on my own have thought about and wondered about for years. And I'm extremely excited about the fact that the very things that he put his finger on are the very things that I have wanted to get fixed. I notice those things. A person who doesn't know me possibly wouldn't pay attention to them, but I'm very cognizant of the things that are residual, result of my stroke. And he picked up on them, and he developed specific exercises that my wife and I can do at home that will help develop the neural pathways that will get around the damaged area. And I'll be closer to being whole the way I want to be whole. And how do you put a dollar value on that? You don't, because there's a lot attached to your self-esteem. If there are things that you used to be able to do that suddenly you can't do because you've lost maybe some of your ability to coordinate your movements.
He's the first neurologist that looked at Roger's MRI and took the time to tell him what part of the brain's been destroyed.
Can you
Most
believe that?
neurologists wouldn't even bother.
Yeah.
I don't know why, but I guess they just don't think that's important. But to a person, just knowing what part has been destroyed is a big step.
Definitely makes you feel like he's interested in giving you everything you need in way of information.
Well, it's like, I guess when people seek the help of a psychiatrist, some people have the notion that you just sit on the couch and talk about, your mother or your background. And then there are those folks out there who are pioneers in the field who believe that you do things because the way your body works is you get the emotion and you go through the corresponding motion. So if you're feeling badly and you just sit around and feel badly, nothing's going to change. You're continue feeling badly. But if you do activities that cause physical reactions in your body, then your body will pump in those chemicals that make you feel good. And you'll be okay. So just get off the couch, get a friend, go do something fun, go fishing, go for a bike ride. And that's the kind of therapy that I think is effective. And he is in this field I think, what William Glasser was in the field of psychiatry. I think he's a real visionary, a pioneer, and I wish that, that folks could see. Because if you were in the situation we're in, where you have a child who's extremely brilliant, this boy, on the test that he's been given, he's way above his age group in terms of his intellect. But in language, he's lagging behind. There are a lot of reasons for that. It's not necessarily related to his brain. He was, both his ears were severely infected, and he had to have the tubes put in, and that went on for quite a while, so it affected his ability to hear and consequently to speak. So having him see Dr. Brown has just, like we said, been remarkable, and as parents, you've got to be grateful. You just want to let other folks know.
That's
hey,
wonderful.
You can do something other than just, you go to a school, public school, they offer these services, but they're doing the exercises that they've been trained to do. Well, he's doing things that are non-traditional. Like, who would think that having a child spin and count could make a difference? But then when you see right afterwards what the child can do, it's like, whoa, really? That's pretty darn creative.
That's wonderful. And I'm really pleased to hear the fact that it's not only helping your son, but as you said, he's even provided you some information that's helped you too and continues to help your family in general. And so that's exciting to know and see that you're moving it forward together.
And we talk, his ears must burn a lot because we talk about him quite a bit.
As parents, I think for the first time we felt empowered to deal with a child that was 6 weeks ago getting a lot more frustrated because he was saying words and his mind was saying them like he hears them and did not understand why people weren't understanding him. That was his frustration. It's not a delayed speech. He was trying to communicate, and that nobody understood him was emotionally just putting him in tears. And with Dr. Brown's, we just know how to deal with those situations, and it feels so good to not feel helpless. I mean, when those situations happen, they're just as much a learning experience as when they're not happening. All the time it's a learning experience, and we have so much more control and peace of mind than we did before meeting Dr. Brown.
Wonderful. Well, we really appreciate that. Was there any last thoughts or comments you wanted to share before we end? I know you've said a lot, so giving us a lot of
We're just charter members of the Dr. Brown fan club, and so grateful that we found him.
The speech therapist that made the most progress with Alexander has had several students that she sent to neurologists with very frustrating results. And it would be amazing to us if 5 years from now, those neurologists followed a little bit of this new type of approach. I think that those children and those parents would be much happier, and we get much better results. Maybe in 5 years from now, that'll be the case.
Okay, well, thank you so much for your time and for sharing those thoughts with us. We really appreciate it, and certainly wish you all the best as you go on with your exercises and the program that Dr. Brown's working on with you. Thank you.
Thank you. Appreciate it.